So welcome to the PowerUp podcast. I'm Dr. Tiv.
And I'm Dr. Krish.
And we're talking about raw dogging it. Now, Dr. Krish wanted me to call this the PowerUp podcast raw dog, but I have no idea what that means. Why raw dog?
It's a good question. Basically, we're doing like an uncut version of everything.
Mm-hmm. A sausage without sauce?
That's exactly, hit the nail on the head.
Anyway,
take that however you want to be.
Anyway, that title is still yet to be decided. I think we should call it just uncut or unfiltered, but Dr. Krish wants another title, so we'll see how it goes. But what do you want to talk about in this very first edition?
I was reflecting the other day about being a new grad.
Oh, yeah.
And what it felt like to be a new grad. I guess we could talk about that.
I can tell you how it feels like to be a new grad. Crap.
Yeah, it feels pretty shit.
Yeah. What was your new grad experience?
Relief, because you're like, oh my God, finally it's over, exams are finished.
Yeah.
All the pressure that you thought uni was just cooking,
yes,
just released, and then you're just thrown out into the world, and then there's a different kind of pressure that builds up.
Yeah. No one really warns you about that pressure, do they?
No one warns you about any of that.
You think uni is it, and once you've done uni, life's going to be cruising.
Once you've got the license to drill, you can just go out there and just do whatever you want.
Yeah. But it's not like that. In fact, even at uni, I don't know about you, but when I was at uni, I wasn't like the greatest, student there.
Yeah.
Like my clinical skills were good and I worked really hard, but there's some people that just had hands that were like amazing.
Yeah.
And they were just like topping everything.
Asians had the best hands. They were just...
I don't know if you can say that.
You can. They just were very good. Like, the majority of my cohort was Asians, and more than 50%, but they were just so good at minute details on like a small scale. It's like, ping pong's a small version of tennis. Like, you know what I mean? They're just good at everything on a small scale. They can just do it. Like, and so for me, I was all Asians, and they were just exceptional, and I was shit.
Yeah. Yeah. And you, like, I don't know, I'm not sure I would classify exactly that way, but I know that there's clinicians out there, well, students at that stage that were so good, and I felt really bad. And I didn't know, like, how I was ever going to make it, because academically, we were just, for me, it was hard because at high school, you were getting 99s, 100%, all, really high scores. And all of a sudden you get into uni, and my first exam, I think I got like 52%. Yeah. I've never gotten 52% before. Yeah. And I was like, what is this place? And what happened? Yeah. And it was just like a huge
reality check.
Reality check. And I realized I went from thinking I was up there to being like, no, you're actually just like one of many that are trying to achieve this.
You're a small fish in a small pond, and now you're a small fish in an even bigger pond.
So how did you navigate the dental school part of like not being like the best of the best? Because it doesn't translate to reality.
Yeah.
Because things change.
It wasn't even not being the best of the best. It was being the worst.
The worst?
Yeah. I remember we had these haptics machines, which were the 3D simulators.
Never had them.
Maybe before your time.
Maybe. I mean, I'm only 27, but still.
And they would make us sort of drill these shapes. And there were 10 levels.
Yes.
And we had 10 weeks of this.
Yes.
And at about week 8, I was still on the first shape.
Oh, wow.
And the demonstrator at the time, which I'll give a shout out to Dr. Imposter, amazing demonstrator, amazing clinician. Like, I look back to her all the time. She was like to me, basically in a cutthroat version, you're shit, you should leave. And I just remember being like, and I hated her because I was just like, you are just making me hate this so much. Yeah. But I looked back, and that was what motivated me, because I was just like, you know what, I've come this far, I need to do something different. So I just had to go in, practice all the time. And, I got better. It wasn't the best of the best, but I got better than being the worst. Yeah. And that's when I realized dentistry is just more than just theory. Yes. You really need to get the hand skills up and running.
Yeah, it's about practice as well, isn't it? Just like actually getting there. Yeah. I mean, what you're saying makes so much sense. It's what I teach in the PowerUp series, right? Like, one of the greatest motivators is pain. Talk about, Apollo, my dog, he goes and sits on... My office is a mess. Yeah. And I'm usually doing projects as well as paperwork. Yeah. And I had these nails, these screws on the ground. And my dog comes up and he just plonks himself on the screws. And he's like, it's uncomfortable. But he just wiggles himself around and just kind of settles there and looks at me. And I was like, why is he sitting on screws when there's like other places out there? And I realized it's because it wasn't painful enough.
Right.
So it wasn't painful enough for him to have an effort to move or do anything about it. If it was really painful, he would have got up and moved.
Yeah.
But it was like uncomfortable. It wasn't great, but it wasn't painful enough. So he kind of just sat there. And that's what happens to us, you know, as students or as clinicians. Things aren't great, things aren't comfortable, but they're not painful enough to do anything about it. But this demonstrator obviously made it really painful for me.
Oh, she gave me a reality check. You know, people don't talk about imposter syndrome enough, but I think it's a really good motivator.
Yeah.
It's a really good internal motivator that you need to
Get better.
To get better. And I like demonstrators like her, I feel like aren't around as much at uni.
Well, I don't know if they're allowed to. Like we've got the uncut / raw dog edition of this podcast, but I don't know if they're allowed to tell you shit anymore.
Yeah.
Like, are they?
I don't know. Look,
like someone's going to complain about it.
Someone's going to complain saying
saying
I'm sad and I can't get out of bed because you said I was terrible. But it's a reality check, right?
Well, I think it's a motivation.
Yeah.
For you, it made a difference. For me, it was Professor Martin Tice, who, you know, told me that I was a menace to society because I'd overcut a cavity prep when I was at dental school. Years later, he invited me back to demonstrate. And I was like, don't you remember you told me I was a menace to society?
Yeah, that's the same thing. Dr. Polster invited me back,
And he was like, don't worry about it. Like, I must have just been off my nut during that time. I don't know what I was saying.
Yeah.
So I was like, okay, fine. We went back. But it was just, I guess it's one of these things where if they hadn't said those things, would we have pushed hard?
Yeah.
I mean, same thing happens here. I push you guys really hard. And
Absolutely.
I'm not the kindest soul in the world when it comes to it.
You're an asshole.
I am an asshole.
Well, this is fake. He's just an asshole, guys.
But it makes you better. It makes you so much better.
Yeah, no, 100%. And it's those moments that you remember. You don't remember the time a demonstrator said, really great work. Because I'm sure there have been multiple times at uni that there were demonstrators who were like, oh, this is really nice. This is really good. I don't remember it. Yes. I remember Dr. Polster because she made me feel the way I did, which pushed me to become who I was.
Yeah.
Yeah.
So, well, maybe that's something we've unlocked is that to have a good mentor, it's not someone that's nice to you.
Someone who gives you a reality check.
But someone who gives you a reality check and is like telling you exactly where you are to give you that pain to move on. Wow, interesting. Mind-blowing moment. That's what makes me so good. Being the asshole is actually great. All right, so you graduated.
Yes.
You were like, hey, everything is great.
I'm still not good, but I've graduated, I've passed uni,
You got your ticket to print money.
Yes, I can do what I want. But I was like, look, I probably in uni, it's kind of like lucky dip, luck of the draw.
Mm-hmm.
Either you get 10 crowns, some people get 50 exos, some people get 2 exos.
Mm-hmm.
I graduated not having done an extirpation, probably
at all,
ever. In fact, I was so desperate to do an extirpation, so fucking desperate that this guy came in and he's like, I've got pain on it's throbbing. And I was like, look, let me just get in there and take the nerve out. We'll get you out of pain. I was so determined that I didn't take an x-ray. I drilled into the tooth and there was GP.
You must have been heartbroken.
I was just like, yeah, FML. But, you know, so I graduated without doing an extirpation, probably graduated having taken out 5 teeth. Yeah. Done a few crown preps more than the others.
Yes.
But I just didn't feel like my experience was great. I just felt like others and it was luck of the draw. You had patients who would cancel because it's a public clinic.
Yes.
And you'd have some patients who would just rock up all the time consistently.
Yeah. Yeah, and you couldn't ever pick it.
You can never pick it.
But I think everyone that graduates from uni thinks they don't have enough experience because you don't.
Yes. 100%.
Even if you ticked all the boxes, you'd get 20 things of each.
Yes.
Which is like pittance compared to like real world exposure. You'd get that in like a month in real world, where it's like taking you 4 years or 5 years to get that at uni. So how did you figure out who your first job was?
Well, I knew I needed to go. Well, not that I knew. I was like, well, so the other thing is you're competing with 100 other people to try and get a job. Mm-hmm. And everyone wants the same job. Yeah. So I thought, look, best case for me is get a mixture of public dentistry, get some patients going through in that mentorship and that training that you get in public as a grad. and then also get that private world experience at a clinic. So I did 3 days at a preferred provider clinic, and then 3.5 days at a preferred provider clinic and 2 days at a public clinic.
Okay.
And the public clinic was a good sort of transition from uni to dentistry outside of uni. When you're in dental school, you're surrounded by your mates, you're having fun, you look over the bay next door and your mate's there doing a filling and you're like, hey.
Yeah.
Whereas private is you're in your own room and you're all by yourself.
Yeah.
And it can be isolating. So public was a good sort of transition point and good for me to sort of understand that the clinical side of things and the isolation side of things and sort of merge it together really well.
Yeah. But there's this risk of being trapped.
Yes.
Because, for me, I was lucky or unlucky in my first job. It was a complete accident. I just ended up in a clinic because they had a job offer. 180 to how I practice now. So the dentist was doing like 30 patients a day, 10-minute amalgam fillings, like back to back. I remember the time when the patient was lying back and he had the injection. He was doing the injection as the patient was lying back, and then the forceps in his hand, and the patient's like, "You're going to save that tooth, aren't you?" And he's like, "Oh, yes." And he put the forceps down and started drilling in to do the extirpation. Obviously no rubber dam or anything because that would take too much time. So, he was great at exos. He was a really good clinician because he did so much work. But the philosophy was so much different to what I had now. And I remember as well, like asking advice from another dentist specialist at the time about orthodontics. And I was like, should I be learning orthodontics? And their advice to me was like, no, you shouldn't. It should only be reserved for specialists. If you want to do orthodontics, you need to do a 3-year master's degree. So I'd spent, 4, 5, 6 years of my career not, progressing.
Staying stagnant.
Yeah, because I'd listened to all this advice.
Yeah, absolutely.
So where you start off can really impact the flow of your career from there on in.
100%.
So what did you find about public preferred provider, all that kind of stuff? Without getting yourself cancelled.
Yeah. That's gonna be tough.
Me cancelled.
Public dentistry was good, but it's again you're very limited with what you can offer people, and people aren't grateful. They come in expecting stuff, and you're like trying so hard to work and doing what you can for them. Private, you're capped at what you can charge. So
At preferred provider.
So after a while, you'd run the numbers and you'd be like, am I just going to be staying at this level for the rest of my life? So you start rushing and doing things quicker so you can sort of start producing more. Because again, you're not limited by the number of patients, you're limited by the fee structure.
Yeah. So your variables are reduced. Your variables are not price and patients.
Yes.
The price is set.
Yes.
So the only way is to determine the number of patients you see.
That's exactly right.
Or the number of item numbers you
put through. Yeah. So a lot of it was checkup, hygiene, like a checkup and a clean, x-rays and a filling all done in 30 minutes.
Yeah, wow.
Yeah, just quick.
Just quick.
In and out, fast paced.
Yeah. But the advantage is you get patients.
Yeah, patients. There's always patients. Your books are always full.
Yeah.
There's always patients coming through the door.
Yeah. So I guess the way to see it is you kind of come up fast.
Yep.
But then you cap.
Yeah, exactly. You're like, oh my God. So you start off and you go, my books are full. This is amazing. Like this is an amazing clinic. It works really well. And look, not all preferred providers are like that, but the one I was at was like that. It was just, I went in being like, my books are full, and other people were like, well, my books aren't full, so I'd use that as a comparison, be like, yeah, well, my books are full, and I'm doing very minimal effort to get them full. Reception's booking them in, it's fine. Yeah. Like every day I've got work.
Yeah. Did you have Facebook, Instagram and stuff when you
right?
Right, because that's a different kettle of fish. Like we didn't have Facebook and Instagram,
right.
So we couldn't compare ourselves to anyone else.
Yeah.
We were just like, this just must be the way it was.
Yeah.
And your 10 friends you had, you'd only compare with them. You'd be like, what are you doing? What are you doing?
Yeah,
and
exactly
that was
right.
it.
Yeah.
Well, the Facebook, Instagram era, all you're seeing is the best of someone's life.
Exactly right.
And no wonder imposter syndrome is really high, because you're like, I'm nowhere near as good in life as those guys.
Yeah. And how do I get to that point?
Yeah.
And there's nothing really sort of giving you that vision.
Okay. So then what did you do after that? How did you even sign a contract? Like, what did you do?
How did I sign the contract?
Yeah, did you just like blindly just sign?
I just read through it, looked at the hourly rate, looked at what they were saying. Well, not the hourly rate, but looked at their structure. And I was an employee at this clinic, the preferred provider clinic. I was an employee at the public clinic, obviously. And just, I guess, blind faith a little bit.
Yeah.
You just sign, hoping that no one's going to screw you over.
Yeah. That's so risky, though, isn't it? Like,
so well, looking back, I'm like, it's so
now.
risky. Yeah. Yeah. I mean, I look back, and when I left, I was like, oh my God, thank God it was only a 2-week notice period.
Yeah.
Like, if it was any longer than that, it would have been so hard to leave.
Yeah.
So, yeah.
Okay.
And then there was a point where, like you said, you rise up really quickly, but then you stagnate. And you're sitting there and you're just like, is this it? And you feel, you come home and you don't feel energized. You're like, this is it. This is my life for the rest of my career is going to be like this.
Mm-hmm.
Life's just going to be boring. I'm just going to do the same mundane stuff, checkups, cleans, fillings, crown here and there, root canals here and there, maybe. And because it's so fast paced, you don't get the mentorship you really want, because no one can really, they're also fast paced.
So they can't step aside.
They can't step aside. As much as they did, and credit to them, they did. It's not the same level that you could get, that I was getting and I'm getting now.
Yeah.
But it wasn't to that level. So you couldn't skill up, I guess, quickly.
Yeah.
Yeah. Or upskill quickly, skill up. I don't know why I said that.
Yeah. Yeah. So you just signed this contract. You were like, I'm just working there. It seems to be good.
Yeah.
You're not getting that much mentoring. You are, but you're like,
but
it's kind of stagnating.
You don't, because you don't know what you don't know. You go, I should be grateful I'm getting something.
Yeah.
But you don't know what's out there.
Yeah. Even with Facebook and Instagram, you don't like...
No one talks about the mentoring and stuff like that. They just talk about, everyone shows off the work they've done and things like that. But no one's going, I'm getting excellent mentorship. Yeah. Like I thought, and I was getting good mentorship, but I didn't know I could get even better mentorship.
Yeah, right. Yeah. Okay. So what... I don't know. Do you have any advice for the people that are watching? Like, it's that time of year. There's going to be a lot of new grads coming out looking for work. They're probably like, "Oh shit, I am raw dogging my contract." I don't know if that's the way you phrase that, but
yeah, that's it. That's exactly right.
It's uncut. I don't know what's going on. I'm like, I've just signed it. Now what do? I don't know if my mentoring's good.
Yeah.
Or my friends are doing so much better than me.
Yeah.
Like you said you weren't a really good dentist. How do you feel now about your dentistry?
Oh. Way better than what I was. I look back at the guy I was, the dentist I was like, I cringe. I cringe. I quiver thinking about this shit that I basically some of the work I did was just terrible.
Yeah.
Just absolutely terrible.
Yeah.
Like we could shit in these people's mouth and it would be better. It was fucking bad. It was so bad. Like, you know what I mean?
It was so inappropriate.
but it was just such terrible work. And now I look at the stuff I'm doing now. Yeah. And I'm like holy shit. Like,
you're proud of it.
So proud of it. I back myself now. I'm just like, I've got friends who'll come up to me and they'll be like, I go to a clinic and it's, I don't get charged, blah, 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 because it's all fully taken care of by insurance. And I'm like, that's fantastic. But deep down inside, I'm like, you're not getting the best that you could be getting.
Yeah.
And I told them that. I'm like, would you do your work for free? So would you ever do your work for free?
Yeah.
Like that. And they'd be like, no. And I'm like, so why should someone else?
Yeah.
Yeah.
Yeah, right. But then we're going to have some people out there that are working with preferred providers.
Yeah, yeah.
They're going to be angry at you now. They're
going to be pissed. They're going to be like, cancelled.
Yeah, they're going to be like, yo, I don't do shitty work. Yeah. I do amazing work.
Yeah. I mean, if...
This is your experience.
This is my experience. This is, again, my experience. This is what you don't know what you don't know. I never thought... And the best thing was when I was working at a preferred provider, I would talk to the guys at the public who were working at these other clinics that weren't preferred provider. Yeah. And I'd be like, man, I do a checkup and clean and a filling in 30 minutes. And I'd be so cavalier and I'd be so confident about it. And they would just be like, no, we take 60 minutes for our fillings. And I'd be like, why? What takes you so long? Why are you taking that long? I would just be like almost condescending about it. I'd just be like, why are you taking that long? Like, what do you need to do? Yeah. And then once I realize the quality that's behind dentistry and how you need
possible.
To take it is possible.
Yeah.
Now, keep in mind, we're comparing two grads. One was taking 60 minutes for his fillings. One was taking 15 minutes for his filling. Yeah. If you compared someone who was 10 years out and someone who had just graduated, and they were doing both quality work, the 10-year out person would probably be doing it in 15 minutes, and the new grad will be doing it in 60 minutes.
But you're doing like-for-like comparisons.
But you're doing like-for-like comparisons. So you're just like, 60 minutes. Like, are you going to do that forever? Like 60-minute fillings? Like, you you get better as your career progresses, as you get more upskilled.
How did you get better?
Practice.
Man, no one likes practicing.
And this is the other thing. I left dental school being like, I will never have to touch a plastic tooth again, except for at CPD courses.
Yeah.
And then did I get a reality check when I...
That was my fault.
Yeah, that was your fault. But no, it was good because I go, look, why am I practicing in a patient's mouth when I could practice outside the patient's mouth so that when I am doing the show or the product, it's like you do rehearsals for a reason when they do shows and productions.
Of course.
They don't go out there and be like, we're doing this for the first time. Or we're doing this for the fourth time.
That's right.
Yeah.
That's a great way of putting it.
Do you know what I mean? You do rehearsals, you do practices.
Imagine, so the analogy of a dentist doing a course and doing a patient is the same as like a Broadway production, just reading the script for the first time.
Yeah,
and then
doing a table read and then going out.
And
that's what you do.
Perform.
That's what you do at these CPD courses. You're on a table and you're doing it on a plastic, and then you're like, I'm going to go do it on the patient. Yeah. You've got to practice a few times. You've got to rehearse.
Yeah.
A few times, 10 times, whatever it is, you get better. We've seen it, like we see it with, one of our new grads that is here. She did probably 50 practices. And I was like, I didn't know she had done 50 practices, but I looked at one of her fillings when she first started and it was dog shit. And then 2 weeks, 3 weeks later, I was just like, oh, how is she doing this so well all of a sudden? Yeah. Turned out she'd been practicing behind the scenes. And I was just like, wow, you can see the difference.
Yeah. Yeah. You see, I mean, I am the asshole because when people join, I'm like, no matter how many years of experience, we do a minimum of 20 preps on plastic teeth.
Yeah, absolutely. Yeah.
And we just see from number 1 to number 20, and the difference is huge.
And the difference is huge is also because you're not slowly progressing with each patient. You're getting faster already, so your time for production decreases.
Yes.
So you can fit more patients in, and you can bill more. Yeah. It's just a positive feedback loop.
Okay. Yeah. So advice for these guys. I cut you off before.
Advice. I understand grabbing the first job that you can because you are competing with everyone else, and you kind of feel like this time anxiousness where you're just like, all the good jobs are going, everyone's taking them with both hands. That's okay. It's not the end of the world. Keep looking. If you're not happy, if you feel unsettled, reach out to people, ask them for advice, and look for opportunities out there. Mm-hmm. You'll meet a lot of people through your CPDs and things like that. My advice would be don't settle.
Don't settle?
That's probably it. Don't settle. It's kind of like dating. You date a person for the first time. You're like, oh yeah, they're okay. You don't go, will I ever find anyone else again, and just stick with them. Yeah. You go, you have to be confident. You got to back yourself, being like, you know what, I'm worthy of more.
Yeah. Yeah. Okay. Yeah. For me, I'd probably say when you're looking for a mentor, the best way is to find someone that you want to be like and just emulate what they do. I think of it like when you go to the gym, you don't want to pick someone that's like, 7 foot tall and big and bulky and a different ethnicity to you and being like, I want to be like that guy, because that's not going to be possible. So you want to pick someone that you want to be like. And then once you've got that person, then you're like, well, what are you doing? Let me emulate what's going on. So that's probably the easiest way to mentor. And just remember that if you follow what everyone else does, you're going to be like them. So you want to try and do something different. Now, that's probably all we have time for today. Mm-hmm. Hopefully we don't get cancelled, we get another episode, but we'll see how we go.
We get cancelled.
I'm going to have to look up what this raw dogging means so that I can see if we're going to use this as actual title or not, because it sounds like from that smiley grin that he's got there, that he's putting me up to it. All right, anyway, welcome to the first episode of the PowerUp podcast, Unfiltered, maybe raw dogged, we'll see how we go. This is Dr. Tiv.
And Dr. Krish.
Over and out.